Your baby is going to be or already has been admitted to the Neonatal Intensive Care Unit, or NICU, at Sacred Heart Medical Center at RiverBend. First, let us say that we recognize this stressful time for you and your family. We believe a healing environment starts with a family that is comfortable within this environment. We want you to become familiar with our unit and feel welcome to come here often during your baby's stay. Your involvement is a very important part of the healing process. Be assured that our NICU has state-of-the-art equipment and a highly trained staff strictly dedicated to the care of your baby. Know that your infant's condition will be assessed every day, and you will be called every day. We place great importance on keeping parents and family informed and taking the time to explain any medical questions that you may have. Most babies entering the NICU have trouble maintaining their own body temperature, so we initially place them on a warming bed. During the initial examination, heart and breathing monitors are attached. This allows us to continually monitor your baby's vital signs. If possible, we encourage families to be at the bedside following initial admission and procedures, so both you and your baby can begin the healing and bonding process together. To help ensure your baby is getting enough oxygen while the lungs become more developed, we have different ways to assist breathing. Nasal prongs are soft tubes inserted into the nostrils, providing a continuous flow of oxygen. Another device is the nasal CPAP, used to provide continuous positive airway pressure after each breath, allowing your baby to breathe with less effort. A ventilator or respirator is sometimes used if your baby needs extra help in breathing. There may be times when the physician needs information about your child, from blood tests or x-rays. To make drawing blood less painful, we use warm heel huggers to increase circulation to that area, and special sticking devices developed just for premature babies. Only a minimal amount of blood is taken. When an X-ray is needed, your baby seldom leaves the NICU, as a portable machine is brought in. A small lead shield is placed over the genital region as a special precaution against radiation exposure. If your baby needs surgery, we will need your written permission before proceeding. We make sure you understand the procedure, why it is necessary, and the associated risks involved. Keep in mind that the watchful presence of the NICU will be there during surgery, as we always have a trained staff person present to monitor your baby's condition. In the beginning, babies are often too sick to be fed through their mouths. In this case, we provide nutrition intravenously. In addition to making sure your baby is nourished and hydrated, an IV is also needed for medications. We recognize the importance that feeding has on bonding with your baby. Even if your baby is unable to feed by mouth, we encourage holding, touching, and skin-to-skin contact. Not only is this enjoyable for both you and your child, studies show that touching actually helps babies to grow and develop faster. Eventually, your baby will be moved to an incubator or isolet. This is a much quieter environment with controlled temperature and humidity. Here, your baby is less likely to be awakened by sounds or chilled by breezes. Sound sleep and conserving body heat help preserve precious energy needed for growing and healing. As we've said, it's very important for you to gently touch your baby. The isolet is not meant to keep you from having contact with your child, so don't think of isolet as isolation. When babies are big enough and able to maintain their own body temperature, they are moved to a crib. From the beginning, you are an important part of your baby's feeding. Our specialists are available to help you learn how to feed your baby. If you are breastfeeding, specialists called lactation consultants will help you learn about pumping and storing your milk. They will also help as you and your baby are learning to breastfeed. The amount of milk your baby receives depends on size, age, and condition. Babies that are too young to suckle or just learning are often fed with a feeding tube. This is a soft plastic tube that goes through the nose or mouth and into the stomach. Having a baby that needs to be in the NICU for special care can be very stressful. Your baby will be connected with monitor wires and tubes to unfamiliar equipment that makes many kinds of alarm sounds. But don't worry, the nurses know which alarms call for immediate response, and they will explain these different alarms to you. At RiverBend, our first priority is for the health and safety of your newborn. Therefore, as parents, you will be issued electronic badges that will allow you to come and go as you please, without compromising the security measures in place. All visitors must be with a parent unless signed permission has been given. We encourage you to visit as often as you can. Your baby will feel your nurturing presence and touch. Talk in a soft voice to your baby. This is a very familiar sound, and even if your child does not respond, rest assured that your baby knows you're there. Studies have shown that the best way to provide parents and babies with the closeness they need while not overstressing the baby is to use Kangaroo care, also called skin-to-skin contact. By holding your baby's chest to your chest while remaining connected to monitors, your baby stays warm, and your heartbeat and breathing helps to regulate that of your baby. Your nurse will know when your baby is stable enough for Kangaroo care. All babies brought into the world need to be cleaned and bathed regularly, no matter the size and weight. We encourage parents to get involved in bath time. We'll show you what to do. Sponge baths are given to babies in ventilators or on the nasal CPAP. As babies get bigger, they get tub baths. Weight progress is carefully monitored, and babies are weighed every day. Special scales with overhead heat lamps keep the tub and baby warm during this process. In addition to physicians and nurses, there are many other people here on the NICU team, some working behind the scenes and others working directly with you and your child, such as respiratory therapists, social workers, clinical educators, and spiritual caregivers. All are dedicated to providing the best medical care possible. Feel free to ask questions of anyone on our NICU team. As you can see, we consider you a very important part of your baby's care, but we encourage you to attend to your own physical and emotional needs too. We are here to help you so you can focus your energy on caring for and nurturing your baby. At Sacred Heart, we are committed to making your stay with us as informed, comfortable, and stress-free as possible during this important time in your family's life. Healing and compassionate care is the cornerstone of our philosophy in the Neonatal Intensive Care Unit at Sacred Heart Medical Center at RiverBend.